Last week, two men said to be under enormous pressure from Lebanon's dire economic situation set themselves alight. One of the men was a taxi driver.
He burned himself because he was strangled by life. He didn't have enough to eat. He couldn't feed his children. He didn't have a place to stay. He couldn't put his children in school.
With limits on how many passengers they can take and a meagre $50 offered as compensation, many drivers can't afford basic living costs, let alone upkeep on their cars. Last year, one driver set his taxi on fire after being fined by police. Others are feeling the pressure too. Each lockdown just compounds their difficulties.
Every time it's getting worse and affecting us a very negative way. So I feel a little bit depressed about it and hope this will end soon.
The fifth lockdown means another month with less work for Wasif, which is tough when the family's income is already dramatically reduced because of the devaluation of the Lebanese pound.
Actually, my salary now, it's worth nothing. Actually, $100 if you want to transfer the Lebanese currency to dollar. But I'm working because all people facing this problem, not only me. And everything is rising in the prices and as you see, we can do nothing.
While the lockdown is pushing people to the limit, the virus is doing the same to the healthcare system. Despite being a week into lockdown, the spread of COVID-19 shows no signs of slowing, and medical experts fear the worst is yet to come. Even before the pandemic, Lebanon's healthcare system was struggling with the currency crisis. The lack of US dollars in the country makes it difficult to import essential medical supplies.
It should be manageable. And in absolute, it is manageable because we're supposed to have 15,000 beds in this country. We always touted ourselves to be the hospital of the Middle East. It just so happened that half the departments of the hospital of the Middle East have been closed down because of the economic situation.
Lebanon's first lockdown was successful in keeping the virus under control. But a series of crises, including the Beirut explosion, derailed that success. Dr. Salim doubts how effective this latest lockdown can be.
The Minister of Public Health has decided that all the public hospitals will now serve exclusively patients with COVID-19, which means that someone with no means and no insurance who has a myocardial infarction or a cancer or an appendicitis nowadays will have a hard time finding a cheap hospital or a free hospital.
And that includes people like the taxi driver, who is not only suffering financially, but is said to have a kidney problem and no health insurance. As the pressure on the people of Lebanon is becoming unbearable, if the country's fifth lockdown doesn't slow the speed of COVID-19, it's likely to get much worse before it gets better. Imogen Kimber, TRT World, Beirut.